If you thought syphilis was a thing of the past, think again. Sexually transmitted diseases, or STDs, continue to rise sharply as 2017 saw a new U.S. record of nearly 2.3 million cases of chlamydia, gonorrhea, and syphilis diagnosed. Our viewers wanted to know if they should be concerned, so I dropped in on our colleague Dr. Freda Lewis-Hall, the Chief Medical Officer of Pfizer, to help tackle your questions. And Dr. Freda, let's start with what syphilis actually is.
Syphilis is an infection caused by bacteria that enters the body usually through sexual contact. And any sexually active person can get infected with syphilis. But people who are ages 15 to 24, as well as men who have sex with other men, are at greatest risk.
But they are not alone. In the U.S., syphilis is rising amongst both men and women of every race, ethnicity, and age group. This first viewer wants to know.
How do you know for sure if you have syphilis?
Dr. Freda, you want to take this one?
I'll take this one.
Alrighty.
Only lab tests can confirm whether or not you have syphilis. It can exist in a person with mild or no symptoms at all. This makes syphilis easy to miss and easy to spread. It can occur in 4 stages. In the primary stage, sores may appear on or around the genitals, the anus, the rectum, or the mouth. In the secondary stage, you may develop a skin rash, swollen lymph nodes, and a fever.
Then there's the latent or hidden stage, which can last for years. Symptoms may never return, or the disease may progress to the tertiary stage where severe medical problems can develop. Syphilis can invade the nervous system and cause dementia, altered behavior, difficulty coordinating muscle movements, paralysis, headaches, and sensory deficits. This may be many years after the original untreated infection developed.
Now, this is a lot to remember, so people can find more information on gethealthystayhealthy.com.
Our next viewer asks,
Hey docs, someone told me if you get syphilis, it can't be cured. Is that true?
syphilis can be cured with the right antibiotics. However, treatment might not undo damage that has already been caused by the infection. If untreated, syphilis can cause serious, even potentially life-threatening health problems.
So, Dr. Travis, what's our next question?
Our next question comes from Twitter. Does having syphilis increase your risk of contracting the HIV virus?
Yes, syphilis increases your risk of contracting HIV, and that's not all. For women, it can also cause complications during pregnancy. A mother can pass the infection to her baby. So if you're pregnant, talk to your doctor about getting tested for syphilis at your first prenatal visit.
Here's another question. Inquiring minds want to know.
I heard that you can catch syphilis from a toilet seat. Is that true?
You cannot get syphilis from a toilet seat. Syphilis is transmitted by direct contact with an active lesion during vaginal, anal, or oral sex. It can also be transmitted by kissing or touching a lesion, but this is less common. Let's move on to an email we received about prevention. I'm sexually active and I want to know, how can I avoid getting syphilis?
Well, the only way to completely avoid syphilis or any STD is to abstain from sex or to have monogamous sex with one uninfected partner. Now remember that syphilis sores can be hidden and painless, so unless you know that your partner or partners have been tested and treated, you may be at risk for getting syphilis. Get tested regularly if you are sexually active. If you're a man who has sex with men, are living with HIV, or have a sexual partner or partners who have tested positive for syphilis.
Latex condoms can also reduce your risk of contracting syphilis, but only if the condom is covering the sores. Even after you've been successfully treated, you can still be reinfected. Follow-up testing with your healthcare provider, that's recommended to make sure your treatment was indeed successful.
And of course, there are tools and resources available to help you. As I mentioned earlier, you can start by checking out gethealthystayhealthy.com, and while you're there, sign up for the monthly newsletter to get more tips and information.
I want to thank you so much, Dr. Freda, because people are afraid to talk about this topic, but so very important. Thanks for having me here.
Oh, thank you for being here.
Stay tuned.